My name's Hisham. I'm a consultant psychiatrist in early intervention service in the NHS in Peterborough in the UK. And this is part 3 of a 5-part video series I'm doing to try and talk about what I try and do in the psychiatry clinic. So part 3 is about diagnoses, formulations, and treatment. Okay. Now, the first part, diagnoses and formulations, I'm only going to talk about very briefly. It's not possible to do justice to either of these in a very short video, but here's what I'm going to say about them. Both diagnoses and formulations are essentially systematic ways of understanding and describing parts of a person's difficulties and suffering. Okay, they come from slightly different schools of thought and apply slightly different approaches to this, but fundamentally what they're about is understanding and describing often parts of a person's difficulties and suffering. Okay, there are only really 2 purposes that they serve in clinic, and I say this a bit more confidently about diagnoses because that's more my sort of prominent, my area. One is to help people and those involved in their care understand what is happening for them. And that includes the person, their family, but also the clinicians who are involved in their care. And the second is to help guide treatment. There is a third purpose outside the clinic for diagnoses, and I'll talk about these in part 5 of the video series. Okay. Now, the thing that I really want to talk about in this section is treatment, and there are some important considerations for treatment. That's to remember some of the nature of mental illnesses and related difficulties. They often involve long periods of illness. They often involve recurrent episodes of illness, and they have attendant effects on quality of life and functioning, which may change or be exacerbated with recurrent episodes of an illness. They involve considerable costs for the individual, and they reshape people's lives and personalities. And so the challenge I see for myself is, what can I do in the time that I have with this person to do the most for them now and for their future? Now, the aim of treatment is essentially to help people recover and rebuild their lives. This will often involve numerous objectives, for example, optimizing medication, helping with past trauma, learning skills that they have missed out on because of periods of illness or periods of deprivation or disruption, addressing difficulties with self-esteem and self-image, helping and supporting with forming and building relationships, modeling caring and being cared for, helping with loss and grief, because very often, either on the journey to mental illness or on the journey with mental illness, people will end up losing a lot. And sometimes you can recover what you've lost, sometimes you can't. And there's the considerable task of grieving for what one has lost, including the possible futures that one has lost. I'm going to say a bit particularly about medication because, again, as psychiatrists, this is an area that we tend to deal with in particular compared to other mental health professionals. And these are the key things I want to emphasize about medication. All medications target specific biological mechanisms, right? So we may use medications for particular syndromes or conditions like depressions, but what the medications are doing are targeting particular mechanisms that we know may be relevant to a particular individual's depression. We know that their mechanisms are irrelevant because we've got studies that have examined that. There's a key part, however, of the clinical evaluation process establishing where there's a reasonable probability that one of these mechanisms is involved in this person's illness or case that one could try and treat with a medication. And the task is to use the available evidence you have to make the best decision for each person that you see. Now, for every medication, you need to consider the following. Is the medication tolerable enough for a trial? And this is about, is it okay to take for long enough for you to see? Question 2, is it effective, right? Now, establishing whether a medication is tolerable enough requires groundwork on your side to try and look at individual factors that may affect people's ability to tolerate medication, including what their past history of taking medication is, what their potential pharmacogenetic background may be, taking into account factors like ethnicity and gender. Is it effective? If it's effective, is it effective enough? And if it's effective enough, is it tolerable enough for them to stay on it for a longer term treatment? And one can and should ask the same of any other kind of treatment. Okay. Now, when I talk about these considerations, in much the ways I talked about the considerations for and purpose for diagnosis, it's one's responsibility as a psychiatrist and a clinician to actually do the work with people to make diagnoses and formulations helpful, to make trials of treatment helpful and useful. So just to wrap this bit up here, the aim of treatment is to help people recover and rebuild their lives. And every treatment trial gives you more data that you should use to revise your hypotheses and your plans for a particular person. Okay. In the next part of the video, I'm going to talk about working with uncertainty, emerging data, and change over time.